Thanks everyone for joining us today. I'm delighted on behalf of the organizers, Professor Michael Lee and Professor Jacques Valère, who will speak to you shortly, to welcome you to this seminar. Let me begin by acknowledging the land that we work on, that we are meeting online. I still wish to acknowledge this land on which the Fields Institute is physically located and operates. For thousands of years, this has been the traditional land of the Huron-Wendat, the Seneca, and the Mississaugas of the Credit. Today, this meeting place is still the home to many Indigenous people from across Turtle Island, and we are grateful to have the opportunity to work on this land. Welcome, everyone. My name is Kumar Murty. I'm the director of the Fields Institute. Welcome to this seminar on endemic COVID-19 mathematical insights, and I hope that wherever you are connecting from, that you're safe and healthy. I understand we have participants from about 15 countries, people from different walks of life, public health, insurance, business leaders, school teachers. To all of you, a very warm welcome. My welcome to you this morning is actually, this afternoon in Toronto, is actually on three dimensions. Firstly, I welcome you on behalf of the Mathematics for Public Health Network, what we call MfPH, of which I and my colleague Jianhong from York University are the co-principal investigators. You will hear more about this network and the research that it is undertaking in the first session. Second, I welcome you on behalf of the Canadian Mathematical Sciences Research Institutes that have come together to establish the MfPH network. Let me take a moment now to briefly introduce you to the scholars who serve as directors of these institutes. We have Professor Octave Cornea, Director of CRM. We have Professor Sanjeev Sierra, Director of the Atlantic Association for Research in Mathematical Sciences. There he is, very good. Sanjeev is in Fredericton, Octave is in Montreal, and Professor Jaydev Atreya is Director of the Pacific Institute of Mathematical Sciences. I'm not sure whether he is able to join us, but he is in Vancouver. Now, those of you who are hardy enough to stay for the entire seminar will get a chance to hear directly from these scholars, from these directors, as they share with you their view of what MfPH has been able to achieve so far and what we hope to achieve in the future. So I said I'd welcome you on three dimensions, and I've told you two. The third is I welcome you on behalf of the Fields Institute for Research in Mathematical Sciences, which is hosting the seminar. Fields Institute is known to many of you, but for those who are new, we are a center for research and training in mathematical sciences, and we range the entire spectrum of that, from fundamental research to most applied. We're about 30 years old, and we're a network of 20 principal sponsoring and affiliated universities. We receive our funding from the province of Ontario, the federal government through NSERC and the Canadian Institute for Health Research, the National Science Foundation, the Simons Foundation, and from generous individual donors. In addition, last year, we, along with the Pacific Institute, the Centre de Recherche Mathématique, and the Atlantic Association for Research in Mathematical Sciences, received generous funding from the Public Health Agency of Canada and NSERC under the Emerging and Infectious Disease Modeling Program. And it is this latter resource that has made the MfPH network possible. We have a stellar scientific program today and tomorrow as we discuss where we have been, where we are, and where we're going in the unfolding public health situation. But before we get to that, I would like to introduce some distinguished leaders to share their thoughts on the pandemic and the role that mathematics and more generally science is playing in our COVID-19 response, and also perhaps the public health role it might play in a post-pandemic Canada. Our first guest is Dr. Harpreet S. Kochhar, President of the Public Health Agency of Canada. Prior to his appointment at the helm of PHAC, he was Associate Deputy Minister of Health, and in that role played a key role in Canada's COVID-19 response. Dr. Kochhar received his doctorate from the University of Guelph and has held senior positions at the Canadian Food Inspection Agency. Dr. Kochhar, please, would you share your thoughts?
Thank you, Dr. Murty. Bonjour à tous et toutes. Before I begin, I'd like to acknowledge that I'm speaking to you from the traditional unceded territory of Algonquin and Anishinaabe people. And thank you for inviting me to help kick off this workshop today. And I'll be brief. I know it's important to get to the meat of the conversation. Just saying that the collection and use of accurate and real-time data to support the decision-making in emergency situations like now is critical, and this pandemic has been no exception. Of course, you know, we depend a lot on evidence-based decision-making, and that has been at the heart of our public health response to COVID-19. Collaboration, innovation in the data sharing and modeling space have been a key component of our collective effort. So while there are many examples, I'd say one of them being the public models. Clear and transparent communication with Canadians about pandemic continues to be essential to maintain the trust and encouraging the adoption of behaviors that reduce the spread and severe outcomes of COVID-19. Theresa is here, who's been a real role model in terms of that clear, transparent communication. We, despite a changing environment and evolving science, we in the Public Health Agency of Canada have committed to providing real-time information through frequent public updates and provision of crucial public health guidance. For example, 2020 and 2021, we shared around 14 public models, and that was a key to us. The second one I'll briefly touch is the wastewater surveillance, working closely with other federal agencies such as StatScan or Environment and Climate Change Canada, Indigenous Services, Correctional Services. We, along with provincial and academic partners, conducted wastewater surveillance on COVID-19 at 15 sites in 5 major cities: Edmonton, Toronto, Montreal, Halifax, and Vancouver. And we've kind of initiated wastewater surveillance in 7 northern remote communities, 5 additional in the First Nation communities. Like, we undertook a pilot surveillance study also at the correctional facility, and this is something which again generates a lot of information which is very valuable, both in terms of production, the data, and the ability to kind of go a little bit ahead in the public health. We're continuing to examine what the endemic COVID-19 may look like in Canada and what is needed to manage SARS-CoV-2 over longer time. The collection, sharing, use, and protection of Canada's health data assets remain really critically important to do this well now and as we look to the future. And Dr. Murty, you mentioned about what it means. And I'd like to express my gratitude for the work of the Mathematics for Public Health Network, a very important, crucial piece. And I look forward to the outcomes of the discussion at this workshop and the ongoing collaborative approach which we have to well position Canada to respond to any future public health threats. Thank you. Merci.
Thank you very much, Dr. Kochhar, for your insightful and informative comments. Our next guest is Dr. Alejandro Adem, President of the Natural Sciences and Engineering Research Council. Dr. Adem is a doctorate in mathematics from Princeton University. He's a well-known scholar with more than 70 research publications and authorship of 2 books. Before his appointment at the helm of NSERC, Dr. Adem served as CEO and Scientific Director of MITAX. And before that, he was the Director of the Pacific Institute for Mathematical Sciences. He's a Fellow of the Royal Society of Canada, and he holds a Canada Research Chair at UBC. Alejandro.
Thank you very much, Kumar. Pour commencer, j'aimerais reconnaître que nos sièges sociaux sont situés sur le territoire traditionnel non cédé des peuples algonquins Anishinaabe. While we meet today on a virtual platform, we acknowledge the ancestral and unceded territory of all First Nations, Inuit, and Métis peoples and their ancestral rights from coast to coast to coast. It's a real pleasure for me to be here at the opening of this workshop. As a mathematician, as we've been through this pandemic, we saw the astonishment with the exponential function in the population at large, the impact of the way pandemics grow, and what you can do to mitigate. And here, of course, we have our colleagues from Public Health Canada, who I really want to salute their efforts. Dr. Tam, thank you for your enormous efforts. And Harpreet, good to see you again, and thank you for all that you do. Now, we were quite pleased to be able to find a way to support the mathematical sciences community in Canada to tackle this important challenge. And this was a partnership between NSERC and the Public Health Agency of Canada. And this was through the Emergent Infectious Disease Modeling Networks program. And I was very pleased to see the entire mathematical sciences community come together and coalesce in a network, which is dealing with these issues and working very closely with folks in many different disciplines, and of course, with the folks in public health. Data is the most important ingredient in dealing with the pandemic. Good, clean data and appropriate modeling so that the policymakers, the decision makers can then act on what is there, what the numbers say. The Canadian government is bases on science, its decisions, and this is, of course, a very important input to the mathematical sciences community. Now, I want to stress here that the mathematicians, which you see at this meeting, this didn't happen overnight. In fact, Canada has been supporting the mathematical sciences community for many years. And in particular, I want to highlight the Mathematical Sciences Institutes who are sponsoring this event. They have received support from federal government through NSERC, also provincial governments and the universities. And they were able to pivot their attention on the particulars of the pandemic. But that is because they have highly trained personnel in areas ranging from differential equations, mathematical biology, statistics, all sorts of different fields. So this is an example of the infrastructure that we have in Canada that can be put to address one of the big challenges that we are now facing. So I look forward to seeing the results of this workshop and down the line, the results of these programs that we funded, and seeing how we can further encourage and support the involvement of the mathematical sciences with these interdisciplinary challenges that Canada is facing. Thank you.
Thank you, Dr. Adem, for those comments. In fact, the point you made about the research institutes and their working together is something that pleases me also very much. I think we have discovered a kind of formidable research tool, which forms like a backbone for our national expertise. And in months to come, please stay tuned as we announce new initiatives to use that tool. We call this overall program MAGIC for Mathematics and Global Impact Center. Math for Public Health is the first pillar of that, and we hope to announce a second pillar very shortly. Our third guest is Dr. Theresa Tam, well known to many of you. She's Canada's Chief Public Health Officer since 2017. Her medical degree is from the University of Nottingham. She's a pediatric infectious disease specialist with expertise in immunization, emergency preparedness, and global health security. During her 25 years in public health, she has provided technical expertise and leaderships on new initiatives to improve communicable disease surveillance, enhance immunization programs, strengthen health emergency management, and laboratory biosafety and biosecurity. She has played a leadership role in Canada's response to public health emergencies, including SARS, H1N1 and Ebola, and she's providing great leadership in the current public health crisis as well. Dr. Tam.
Merci Professeur Murty pour m'avoir invité à lancer cet atelier important et opportune. I'm joining you from Ottawa, the traditional unceded territory of the Algonquin and Anishinaabe people. The COVID-19 pandemic has presented our society with many challenges, but also opportunities. In terms of opportunities, we've been able to leverage new tools to turn data into actionable insights, such as better application of advanced mathematical modeling techniques to help us achieve public health objectives. So thank all of you for responding to our call for collaboration in the early days before COVID-19 was even officially declared as a pandemic. And thank you for staying the course as participants in our external expert modeling group, and then by creating the Mathematics for Public Health initiative. Your modeling has been an invaluable resource in helping us understand COVID-19 disease dynamics. This has both enhanced our planning and enabled us to calibrate some of our responses. It's possible that we are turning the corner on the Omicron wave, although our health systems are extremely strained. With potentially high levels of population immunity from both Omicron and the boosters of vaccines, we may see transmission decrease along with severe illness in the weeks ahead, at least for a certain period of time. While we expect that COVID-19 will be with us for the foreseeable future, critical questions remain about what the endemic COVID-19 may look like in Canada. And I don't think everybody has the same definition of endemic. So I think having you help us understand that would be great. So at the national level, we are thinking through what changes are needed to sustainably manage SARS-CoV-2 over the longer term, while maintaining flexibility to rapidly respond to new variants of concern. Many of the discussions planned for this workshop will be key to informing our thinking on the path forward, including on things like, well, what non-pharmaceutical and pharmaceutical interventions are necessary for us to transition from the epidemic to endemic state. This multi-sectoral network connecting scientists in public health and universities, as well as public health and government leaders, has been a model, I think, for how we can close the gap between knowledge generation, science, policy, and practice. So as we move through the next phases of the pandemic and COVID-19 eventually recedes from the fore, we must continue to nurture our collaboration to ensure we can better manage endemic diseases and are duly prepared for the next public health threat. This is the first global pandemic we have faced in the full swing of the digital and social media age. So communicating mathematical modeling and complex concepts to decision makers, public health leaders, and the media can be a really daunting experience. Know that I share this communication challenge with you, and we're all learning more as we go. So after all, this virus has taught us to be humble in the face of uncertainties. So thank you, merci, and miigwech.
Thank you very much, Dr. Tam. Indeed, it has taught us humility, it has taught us open-mindedness, it has taught us collaboration and cooperation. So in the end of this, we hope that we will carry those lessons forward to building a stronger country. Good, so these are the introductory remarks. Now I would like to, it's my pleasure to pass